Ehlers-Danlos Syndrome, the bendy, stretchy, everything hurts and I'm dying disorder. Medical students are often taught when you hear the sound of hooves, think horses, not zebras. Zebras refer to rare conditions. They're taught this in an effort to prevent them from making an incorrect diagnosis of a rare or unique disorder. So, people with Ehlers-Danlos are medical zebras. Ehlers-Danlos is a group of hereditary conditions that affect the structure and function of collagen and connective tissue proteins. A defect in collagen can weaken the connective tissues in the skin and bones and blood vessels and organs. As of 2017, there are 13 subtypes. Of the 13 subtypes, 12 have been genotyped and gene mutation is sequenced and cataloged, with the cause of hypermobility Ehlers-Danlos remaining unknown. Several signs and symptoms of Ehlers-Danlos overlap with other disorders such as hypermobility spectrum disorder. There's also Marfan syndrome and Loeys-Dietz syndrome, but those last two have other like physical manifestations, appearance, like facial malformations that give those two away. As a rare disease, Ehlers-Danlos is commonly missed or misdiagnosed. It is thought to affect 1 in 3,500 to 1 in 5,000. Some of the more uncommon subtypes are thought to affect 1 in 40,000, and the ultra rare affect 1 in a million. This disorder can affect all races and it's not sex linked, so it can affect all genders. The known inheritance patterns are autosomal dominant and autosomal recessive. The subtypes of Ehlers-Danlos are classical and classical-like Ehlers-Danlos, which have the most common features, and we'll go over those in another slide. You have the cardiac, valvular, and vascular, which affects the cardio system, and that one can lead to a lot of like heart attack and blood pressure issues and strokes and other blood issues. Arthrochalasia is characterized by hypermobility and frequent dislocation of your joints. Dermatosparaxis is characterized by thin, papery skin that tears and cuts and bruises real easily. Brittle cornea syndrome, that one just sounds awful to me because it's the eyes, and the eyes freak me out a bit, but cornea hemorrhages and ruptures and glaucoma and other eye issues are frequent with that one. The spondylodysplastic Ehlers-Danlos, spondylo is your lower spine, and that one will have a lot of lower back problems. That has a lot more of the obvious physical malformations. A lot of the people will have short stature, bowed legs. Weakness is common, and sparse hair, and possible intellectual development disorders. Musculocontractural has like severely adducted thumbs and clubfoot and possible facial clefting. Myopathic has a lot of hypotonia and muscular atrophy. Periodontal affects the mouth, and that one has severe gum disease and problems with like the cleft and the palate, and it can affect speech. Kyphoscoliotic is a combination of both kyphosis and scoliosis. So your back is just all sorts of twisted and not straight. Hypermobile Ehlers-Danlos is kind of a catch-all that they use for everything else that they haven't genotyped. There is some debate in the medical community as to whether that is even a type of Ehlers-Danlos or whether that ought to fall under like the hypermobility spectrum disorder or something else. Common symptoms, side effects, and characteristics of Ehlers-Danlos is pain, fatigue, frequent injuries, easy bruising, and like arthritis. You can have arthralgia and joint deformity. You can have myalgia and myasthenia and muscle tension, which to me, the muscle tension seems kind of counterintuitive to this, considering this whole disorder is about being flexible and hyperextensive. But what happens is in your body's attempt to maintain equilibrium and homeostasis, it will tighten the muscles around any part of the body that is prone to injury and dislocation and hyperextension in an effort to keep it in place. Neuralgia and neuropathy, unstable joints, dislocations and subluxations, weakness of the voice box, hernias and prolapses such as hemorrhoids and cystoceles, soft velvety skin, skin hyperextensibility, fragile skin that tears and bruises easily. You can have issues with scarring. Scars are made up of a lot of collagen. So when you have a disorder of the collagen, you can get keloid scars, which produce too much collagen. They balloon up, and those have a tumor-like appearance because they go up over the original injury site. You can have molluscoid pseudotumors, which is frequent on your elbows and knees and other places of high pressure. What happens there is the scars will balloon up and then they lose blood circulation and they calcify. You can also have like hypertrophic scars, which balloon up, but they don't expand past the original injury site, and atrophic scars, which the collagen doesn't form properly. And so those ones will appear depressed and sunken in and have a weird, like papery looking skin tissue over it. Less common characteristics are arterial, intestinal, and uterine ruptures, congenital hip dislocations, hypotonia, and severe gum disease. Comorbidities, the other disorders and diseases that go hand in hand with Ehlers-Danlos, are upper and lower gastrointestinal complications such as dysphagia and sluggish stomach and bowels, often causing nausea and acid reflux, emesis, bloating, pain, absorption issues, which then can lead to mineral and vitamin deficiencies and anemias and stuff, and food intolerances. You can have autonomic disturbances, which affect your heart rate and blood pressure, bowel and bladder function, and temperature regulation. If you have weak muscles, then that can affect your heart because your heart's a muscle. That can affect your bowels and your bladders. And you can also have anxiety and depression and phobias that go along with this, organ and systemic inflammation from mast cell activation, which is pretty much anaphylaxis without the introduction of an allergen, and it doesn't have to affect your airways. It can affect any part of the body. Diagnosing Ehlers-Danlos, genetic testing is necessary for confirmation for all types except for the hypermobility Ehlers-Danlos because that gene mutation is unknown as of right now. Testing could be like a simple blood draw or skin biopsy or others, depending on what they are testing for. The skin biopsy is used when they are trying to see how the collagen structure is in the skin. Imaging can help identify other features of it. Obviously, the kyphoscoliotic and like arthritis and stuff will imaging will be useful on identifying those. For diagnosing hypermobility, they use a combination of the Baton score and the Brighton score. The Baton score measures hypermobility, and the Brighton score is broken up into major and minor criteria. For that one, you can have either both of the major criterias. You can have one major and two minor criteria. You can have four minor criteria or two of the minor criterias and a first degree relative, which would be like a parent or a sibling or a child that has been diagnosed with Ehlers-Danlos. There is no cure for Ehlers-Danlos. Treatment normally follows more of a management approach. You can get your cardiac workouts, a lot of physical therapy and pain management. Psychiatric help is often prescribed, especially since there's the associated anxiety and depression and phobias. And obviously, if you're in chronic pain or just experience a traumatic injury. Occasionally, surgery is used for complications, but surgery is generally you try to avoid that due to the risk. People with Ehlers-Danlos have issues with scarring, slow healing, excessive bleeding, dissection, and post-surgical hernias. The primary resource for anything Ehlers-Danlos is the Ehlers-Danlos Society. Their website has any information that anybody could ever need. They offer a directory to locate healthcare specialists in Ehlers-Danlos. They operate their own research and clinical care center. They offer guides for physicians and patients on treatment. They offer guides for patients on how to live with Ehlers-Danlos, and they offer guides for caretakers for caring for people with Ehlers-Danlos. And pretty much any information that anybody would want for Ehlers-Danlos, you can go there and find it. GARD, which is the Genetic and Rare Disease Information Center, is operated by the National Institutes of Health, which is a government agency. GARD has several resources available. You can call them and help find geneticists and healthcare specialists. They also direct most people to the Ehlers-Danlos Society website at ehlersdanlos.com. Hi, everyone. I'm Buckley. I chose the topic of Ehlers-Danlos because this is something that I myself have been diagnosed with. Common manifestations of Ehlers-Danlos is what is commonly called double jointedness. A lot of medical professionals don't like that name because it's kind of a misnomer. It implies that you have two joints there when really what it is either a subluxation or just joint hypermobility. I have the skin hyperextensibility. If you go look at that Baton score, you can see the thumbs to the forearm is a common feature of it. Um, with the elbows, this is pretty close to a normal range on extension for an elbow. And this is Ehlers-Danlos. So one of the other symptoms is frequent injuries. And I actually injured this elbow several years ago, and it severely limited my use of this elbow. It gave me what is a normal extension for the elbow, but it inhibits my ability to like throw a frisbee and use it in other manners. Uh, when my older brother was in high school, he ended up sustaining a sports injury, which was a dislocation of his left shoulder. Pretty much it was a total separation. About the only thing that held his arm on at that point was the skin. That required a lot of surgery and a lot of physical therapy. But one of the post-surgical physicians that my brother was seeing at the time started noticing the atrophic scarring and some of the skin and collagen manifestations, effects on the cartilage. And this physician mentioned to my brother and my mother about Ehlers-Danlos, who, of course, never heard of it at the time. But thanks to that one keen physician, we were able to go forward and get this diagnosed. Uh, my brother and my mother both have issues with their jaw. I don't know if it's a total dislocation or if it's a partial dislocation, a subluxation, but I've suffered through those a couple of times and they are not pleasant. This brother also, he can roll over in his sleep, and just the pressure of the body weight on either shoulder will pop him out of socket, and he kind of just has to pop him back in and continue sleeping. He is actually following up on getting the genetic testing done. Genetic testing can be kind of pricey, and so we haven't had it done yet, but he is following up with himself and one of his sons to get it done and hopefully see if we have one of the 12 genotyped subtypes. I have another brother who is prone to, he has chronic hernias. He cannot keep his guts in. He's had multiple surgeries to have it patched and stitched up and his organs shoved back inside of him where they ought to be. He is doing better now later in life. I don't know if that's just him being more cognizant of his body and building up his core muscles and inguinal muscles to help hold things in place. He's also had career changes that are now more beneficial to his health. I have an older brother who ended up having an arterial rupture. Just so happened that it happened in his brain. He had a stroke at 2 weeks after turning 42. And so that is a morbidity of Ehlers-Danlos, is it can severely shorten lifespan. For me, I don't have a lot of life-altering issues with it. I pretty much have a brace for everything. I have a brace for my elbows, my wrists, my knees, my ankles, but I don't consider myself a sufferer from Ehlers-Danlos because the severity of mine is pretty low. It's pretty minor. Um, I don't have the frequent dislocations. I don't have the chronic hernias. So for me, treatment is more just training myself to listen to my body, to know my limitations, and to avoid getting injured. uh, Other people with more severe types of Ehlers-Danlos with a higher degree of severity of it, these dislocations and the subluxations aren't necessarily painful. And there's a lot of dancers and contortionists who will actually incorporate these dislocations because it's pretty easy with such loose tendons and muscles to dislocate something and pop it back in with it not being felt so much. Me, when I was younger, I kind of quit doing it after I became an adult, so like 18, 19, but I used to be able to shove my fingers into my arm socket, into my shoulder socket, all the way past the middle knuckle. I could just, but that started freaking me out, and I've gotten a little bit older. I don't enjoy doing that so much. I do have one more video for y'all to watch. It is a Britain Got Talent of a dancer who incorporates the dislocations into his routine. And I hope y'all enjoy it. References I used for my presentation, most of the PowerPoint slides came from the Ehlers-Danlos Society website. A lot of my talking points came from the National Institutes of Health website. Uh, the genetic chart came from the EDS Wellness website, and the Baton and Brighton score chart that I had came from the Chronic Pain Partners website. And then there's also Life. Thank you guys for watching. I hope you enjoyed.